Good morning to you and to all our audience and all people who helps us to make this broadcast possible every morning. We start this briefing with good news. In the last 24 hours, we have not had any deaths, and yesterday we didn't have either, and we are really looking forward to the possibility of continuing this trend, notwithstanding the fact that this is a disease that, because of its severity and the toll it takes on some patients, it is very dangerous, above all for those patients with certain pre-existing conditions which are well known to our population. Today, we have 981 patients admitted to our hospitals, which is the lowest number we have had since we started with hospital admissions on the pandemic. On surveillance, we have 21 suspects, 639 and 321 confirmed cases. In primary healthcare, we have 3,365 people. Yesterday, our laboratories did a great job and processed 2,460 samples to detect SARS-CoV-2 on people with COVID-19. Of those 2,460, 22 samples, that is 0.9%, were positive for COVID-19. In this way, Cuba accumulates 79,834 samples studied, and 1,862 are confirmed positive, for 2.33% of the samples processed in our country. Of the 22 new cases that were confirmed for COVID-19, all of them are Cuban. 20 of them, that is 90%, 90.9%, are contacts from previously confirmed cases, which out of a cumulative of 1,633, it represents 87.7% of all the patients confirmed in Cuba got the infection from a confirmed case. I was asked earlier how, if confirmed cases are hospitalized, how is it possible for people to be infected from those cases? And then we have to explain that the confirmed person is admitted from the moment they are studied. But we also know that people sometimes have symptoms before being admitted, and furthermore, as we know about this disease, it is transmitted even before symptoms appear. Therefore, it's logical that people who have been in contact with that confirmed case are at great risk, and in fact these contacts are admitted, are hospitalized, and they are studied. And as I have also said several times, it is the most important source that we have to detect positive cases of SARS-CoV-2 and COVID-19 is specifically this group. In 2 of the cases, the source of infection could not be specified. A total of 57 cases have been reported in this condition, that is 3.06% of which have not been identified, although the source of infection is still investigated and is often detected. With source of infection abroad, this figure changes little because very few people are coming in from abroad. It remains at 131 or 7%. Of the 22 cases, the female sex was 12, that's 54.5 for a cumulative of 910. Women are still fewer than men in terms of the cumulative total. Male cases were 10 yesterday, but they have a cumulative total of 952 in the epidemic, which is 51.1% of the cases in our country.
De los casos confirmados en nuestro país son del sexo masculino.
It is important to note that 81.1% of the newly diagnosed cases yesterday were asymptomatic, and they were diagnosed among those contacts of confirmed cases we were mentioning earlier.
Y se mantienen muchas veces en el momento del diagnóstico asintomáticos.
Thus, since the beginning of the epidemic on the island, practically 50% of the diagnosed patients have been asymptomatic. That is 49.6%. Yesterday, of the 22 cases, the age group of under 60 years had the highest number with 13 cases, that is 59%, and the 60 and above with 9 cases with 40.9%. We did not have confirmation of any child in our country yesterday. And most of the cases belong to the province of Matanzas with 19 cases. That is 86.3% of the cases that were confirmed yesterday. Of the 1,862 patients diagnosed with COVID-19, 321 patients are still admitted. These are the patients our population knows we call the active cases. They are the patients who are confirmed and who are admitted. Of them, 314, that is 97.8%, have a stable clinical evolution, and this is favorable from the point of view of the behavior of the epidemic. We regret the death of 79 patients in our country, and as I said earlier, none of them yesterday. We have the 2 evacuees, and yesterday, again, there were more discharges than confirmed cases. There were 35 discharges yesterday. Of the 1,862 diagnosed patients, 1,460 have recovered. That represents 78.4% of all the confirmed cases. And there are 2 favorable indicators: that those who are still admitted, 97.8% have a stable clinical evolution, and that 78.4% of all diagnosed patients have recovered. And I always say they are either back to their regular activities and their lives, and others are still quarantined in their homes for an additional 14 days. The 79 dead represent a lethality of 4.2%, and we remain in the 14th place in the Americas region, which has a lethality of 6.02%. There are 14 countries in the Americas that have a lethality above the average rate of the region. And among them, we always mention Mexico with a lethality of 10.5, followed by Ecuador with 7.67, Canada with 7.45, Brazil by 6.9, and the United States with a lethality of 6.06, and the islands of the Caribbean, they also have high rates as compared to the average rate of the region. In our intensive care units, we have 2 patients in critical condition and 5 in serious condition, 1 less in critical condition and 1 in serious less than yesterday. Yesterday, from the migratory point of view, 27 Cuban travelers entered the country. They are residents of the country. They are air crew members. And with this, there are no changes in the figures of visitors we have in the country. There are 5,845 Cubans who reside abroad and 4,138 foreigners. No changes in the number of foreigners staying in rental houses, with 935, primarily in the municipalities of Santiago de Cuba, Plaza, Centro Habana, and Playa. In relation to the world, one sees the news and one sees that some countries have been, as they are calling it, de-escalating. They've been de-escalating for several days now. That is, they are removing a little bit, removing the restriction measures, and we see the explanations of what is opening up. And there is a common denominator. The last thing they open is schools. However, shops, hairdressers, barbershops, gyms are opening gradually. And these are countries are doing this even with having a high number of confirmed cases, and what is worse, with a high number of fatalities. Until last night at midnight, there were 185 countries with cases of COVID-19. The Kingdom of Lesotho joined the group. We had talked about 14 countries that were not reporting cases, and Lesotho has now been removed from this group. The countries that are still reporting no cases of COVID-19 are North Korea, Kiribati, Marshall Islands, Micronesia, Nauru, Palau, Samoa, Solomon Islands, Tajikistan, Tonga, Turkmenistan, Tuvalu, and Vanuatu. And there are already 4,405,680 confirmed cases in the world, with an increase of the last day of 96,871. There are also 5,435 deaths in a single day, out of a total of 302,115 deaths in the world, for a lethality of 6.86. The region of the Americas already represents 44.11% of the total number of cases reported in the world, with 53,604 new cases reported yesterday, and a total of 1,943,455 confirmed cases. Likewise, yesterday, there were 3,242 deaths in our region, for a total of 117,069 deaths. And as I said, the lethality of the region is of 6.02%. And this is all the information we're bringing to you today.